Hello, everyone. I'm so glad to be with all of you today. My name is Caressa Paulino, and I am the Director of Strategic Initiatives at the Santa Clara County Office of Education. Next slide, please. Okay, so we are now in the peer learning portion of our community of practice. As was mentioned at the top of the meeting, it is clear from various types of feedback and discussions that we've received in the past few months that there is a lot of interest for deeper dives and more technical assistance around available funding sources to support school-based behavioral health services. Today's community of practice marks the launch of our series on blending and braiding funding sources. Each session will provide background information on a specific funding source and spotlight a COE or LEA demonstrating its practical application. So throughout the series, we aim to support COEs in advancing their approach to envisioning how blended and braided funding can support their vision for student behavioral health and identifying the key conditions necessary to achieve that vision. So in a moment, we'll hear from Michael Lombardo, who will provide an overview of funding sources that support behavioral health services in schools. He'll then spotlight how these funding strategies are being implemented in practice with insights from Jessica Pozos of Mount Diablo Unified School District. We recognize that everyone is at different stages in their sustainability journey, and we want to acknowledge that. Our goal today is to foster peer learning that illuminates possibilities and practical approaches in this work. So Michael and Jessica will kick us off with their joint presentation. We will then have a short break after that presentation. When we return from the break, we will go into breakout rooms for our peer learning discussion. Returning from breakout rooms, we will share key takeaways, again, by using Slido. Before the Q&A, we'll take time for feedback to better understand what topics you'd like to explore in future sessions and how we can best support you in this space. As an adjustment for our February COP, we've moved the feedback session before the Q&A to ensure there is dedicated space for your input on shaping future COPs. Additionally, Michael and Jessica will be available during office hours on February 21st, because we don't have one on Valentine's Day, February 14th, to answer any follow-up questions. And to help structure our Q&A, we ask that you submit any questions that may come up during the presentation via the Google form.
I'm going to give you 4 quick strategies, starting with prevention, ended with braid funding. So first strategy, prevention. And you could click the slide. In our effort to do this work, we tend to forget about prevention. We are so keenly focused on the deep end of the system, we forget that small amounts of resources really can help the most children. We can right-size our system by making sure we still talk about prevention every time we have conversations, to think about funding. What are we doing to help students where they're at, tier 1 supports. Click the slide. Otherwise, it looks like this, where we're spending lots of money on the deep end of the system, and it's increasingly hard to get out of that. So I know we're under a lot of pressure to think about our tier 3 supports, but please, please, please focus on tier 1 and at a right size, so we don't have to spend as much resources on tier 3. And you'll see that through Jessica in just a moment. Next slide. Also think about this funding life cycle. We tend to chase grants. We get a funding opportunity, it comes in, we implement that. We do some compliance and maintenance report in, and then it's over, the end. Click the slide. And it happens like that. We don't really think about how are we going to sustain this funding on a life cycle. Click the slide, please. What I'd like to do is think of it more like this. We receive a funding award, it builds up, along this business or this improvement life cycle. And then without innovation or without new things, without new partnerships, we will eventually be on that fiscal cliff. So now is the time, if not a year ago when they started, to think about who can I partner with? How can I strategize to bend this business curve, this business life cycle? Because it does end up with the ultimate conclusion of projects and the lack of funding. Next slide. Real simply, I just want you to visualize, and I use this tool in Placer. I don't know if they're on the call today, but what an impact when we graphically displayed what our funding looked like for my management team. And then we use this for my implementation team, my line staff. We want to be transparent. We want to say, here's what our funding looks like. Here's what's going away. Here's what's good. And it's very difficult in Escape or whatever system you use to think about this graphically. Another note for a lot of you on the call, you're having some pushback from staff. You know, they don't want to bill, or that's not my job, or things like that. When they start to look at things this way, and the fact that things are going to change dramatically if we don't start billing, if we don't start new innovative strategies, they tend to lean in a little bit more too. So being transparent about where we're at. Click the slide. And then lastly, just click through all of these. So without an integrated system, everyone doing their own thing, it's that picture on the right. And then in the picture in the middle, we tend to report out. And then at the end, we tend to silo our funding. What I really want you to think about through this learning series with Caressa, David, Brent, and team is this next illustration on the next slide. I know Mike Lombardo is going to slow braided slide again, but bear with me. Really lean into this idea. How do we braid funding? And I have some tools I can share with you offline to look at it. We can't get into those today, but there's no single funding source that's going to do this, people. It's going to be hard. It's going to take creativity. We're going to have to use multiple designs, and that's what you'll learn through this series is everything between soft funding, Mental Health Student Services Act, which is ending, the BH Services Act, Behavioral Health Services Act, which is beginning. And honestly, there could be really good opportunities on the horizon through BHSA. We just don't know yet. Our managed care plan, LEA one-time funding, special ed, fee for service, etc.
At this point in our presentation, we want to give folks a minute to reflect on the content by answering the following questions, again, by using Slido. So the questions are, has your COE or LEAs coordinated the implementation of tiered supports using MTSS? Are you using this coordination to also design how you braid funding for support?
And
So
I'll just add, Carissa, real
go
quick.
ahead.
That should say coordinated the implementation of mental health tiered supports. I left that out. I apologize. Thank you.
Thank you, Michael, for clarifying that. So to access Slido, you can use the link in the chat. Go to slido.com and enter our room code 3905466, or you can also scan the QR code on the slide. Once you are able to access the Slido, please share your answers to the questions, and we're going to give you all a few minutes to answer, and we're really excited to see what your responses are. So we'll give that a few minutes. And Tiffany, if we could, in a few seconds, move over. Perfect. Excellent. Seeing a lot of yeses. Using MTSS as the framework. Great. One no, but I love the growth mindset. Hope to do it. All right, so please keep those answers coming. And thank you all for participating. Now I'll pass the mic back to Michael, Jessica, and Jessica.
Thanks so much, Carissa. I love these answers. I wish I could watch this longer. But please keep answering the questions, because I'm noticing something, a trend. We work really hard in California to look at MTSS design for our schools, or the public health model design. And we're doing that really well, reflected in the answers. But what a lot of us aren't thinking about is, how do we organize our funding along the same tiered intervention of supports? How do we think of funding in a way that is also supporting tier 1, tier 2, and tier 3 services explicitly, right? And so as we move forward through these sections, think about funding, but also think about, there's a lot of free supports. The state spent $4.7 billion to support you all in prevention. See, Safe Spaces here is a web-based system to provide greater awareness to the impact of stress, trauma on health development and learning in the classroom and at school sites. We want to deepen the knowledge and practices of adults on campus. So Safe Spaces is a web-based program for all adults on campus. It's an opportunity to deepen the toolkit. I don't want to get into our needs for impacting those vulnerable decision points that we have throughout the day as adults. But the more tools that we have and that we give our staff, the more opportunity we have to prevent things like expulsion due to impact of trauma on students. Next slide. Oh, I did have this in there. So there you go. UCLA UCSF is now with UCAN. I'm very excited about this partnership. There's a web link when you get the PowerPoint to UCAN and what the work they do. Next slide, please. So Jessica, what's happening in Mount Diablo?
Thanks, Michael. So I was connected with Safe Spaces at the beginning of our school year, and we decided to push it out to starting with our mental health teams first, our mental health programs. And so within those programs, it was the administrators, our special education assistants, our special education teachers, and our mental health clinicians, so that we were ensuring that they were all hearing the same wording. And once we got that done, we decided to open up to the larger part of our district. And when we did that, we used our professional development days to offer that. And so we set it up for the ability for our staff to come in, sit down in a room with licensed clinicians and take this online training, with the availability of the clinicians to answer any questions they would have about trauma or safe environments within the school setting. And we'll be offering that program again in March in our next professional development day. And we found that transportation staff and our special education assistants and our campus supervisors were very interested in this training. I will let you know it is a very long online training, so we did have to break it up a little bit. And the funniest part was the most questions we got were, how do I log in, or what is my password? So technical difficulties did happen, but we were able to provide this for our staff. Next slide, please. The best part about this was we're trying to reduce the mental health stigma. A lot of our staff think it's just behaviors, or the kids not wanting to do what they are being told. We really want to support our administrators and our classroom teachers to understand our students. We want to reduce the time out of class, reduce the time out of school. Oftentimes it's suspension, or this kid needs to go, but really we don't understand why the kids are having these behaviors. We want to create a safe space for our students to increase our attendance and our productivity of the students, right? We want them to get their credits. We want them to get the learning so that they can graduate. And we want to create relationships with staff who are understanding of our students when they come in really grumpy because maybe they didn't have a lunch, or mom or dad fought, or police were in the home last night. And so it really can impact a student and how their day is. And our staff really need to understand, hey, we need to stop and ask these questions first before assuming.
We'll talk about wellness coaches, and I'm not going to stay here that long. We could do a whole couple hours or day-long session on wellness coaches, but I want you to think about wellness coaches as part of your prevention continuum. Early data from Santa Maria Bonita is showing wellness coaches are impacting exactly what Jessica was just talking about. attendance, kids connecting with school, kids participating in school more. Next slide. So great news, wellness coach, if you haven't heard, and I think everybody on this call has heard, the degree requirements have continued. The education, or have expanded. The education pathway has continued and still requires the 4 degrees, but the workforce pathway shown on the next slide has expanded to any degree program. Currently we have, go ahead to the next slide. Currently, there's close to 2,000 wellness coaches, give or take. I haven't checked this week. We were at 1,700 earlier. So this degree expansion has really helped to reinforce people's ability to become a wellness coach and the workforce pathway that wellness coaches support. I know some of you are thinking right now, gosh, you know, Mike, this employer support grant is ending and the fee schedule is beginning a little later than we thought. Please provide that feedback to HCI. They are taking everything into consideration. So they love it when I prompt you all to send HCI emails about stuff like that, but they do appreciate your feedback. Next slide. So I can't do anything without thinking about it in a tiered way. And not in this deck, but we also do an illustration around swim lanes. So I want you to think about your wellness coaches, how they fit into your continuum at tier 1, tier 2, and tier 3, and how we fund them at each of those tiers moving forward. So next slide, please. So let's move now to the digital platforms, and we're going to highlight on this next slide you see Soluna and Bright Life Kits. But there you go. So Soluna and Bright Life are in place to help support, not supplant, our health plans, schools, and counties. This is an added tool for each of our groups working with kids in and around schools in the community, just to enhance the services. It's for all children in California and adults. You'll see that Soluna and Bright Life is for both students as well as their family members. Next slide. So think of Soluna and Bright Life into 2 age categories. So Bright Life kids, 0 to 12 years old, and Soluna for up to 13 to 25-year-olds. Obviously, young children aren't going to be logging in online and doing those things. So Bright Life is really for adults, to help adults think about how they can support their child's mental health and wellness. I wish Dr. Sohail Saad was here today. He'd talk about his own experience going through the Bright Life program, supporting his own kids through the resources on Bright Life. And then the impact of Soluna, Jessica's going to talk about in just a moment. Next slide. So out of all of the work streams, everybody, they've all done a really good job. Soluna and Bright Light have done a spectacular job at making this as easy as possible to implement. So I'd like you to download the partner toolkit, reach out to Bright Life, reach out to Soluna, and they will send people to your campus to help you launch these programs in any way, anything that you need to make it happen. They're there to support you. It is really pretty remarkable. They've set up a system across the state where there's regional partners who can go out to your schools as big or small as they might be. Next slide. So Jessica, what have you done with Soluna?
Thank you. So with Soluna, we have contracted with them and they sent us a kit. We have a representative. They've been really resourceful and it's been great. We did pilot it first with a few of our counselors and behavioral health specialists, and we got really positive feedback from the staff, but also from the students. And you can see a quote here from one of our school counselors. They provided a detailed letter connecting Soluna with Mount Diablo Unified School District so we could push it out to our parents, and tailored letters that we could send out to for our school sites to send out to families and students. They offered to also come in to do presentations for us, so they're a wealth of knowledge We're also looking at Bright Life. I have a meeting with them tomorrow, actually, and it's been a great resource for our students and families.
Think about the capacity grant is if you've seen a county, you've seen one county in their rollout of the capacity grant. It's quite a bit different in each of our counties. But the ultimate goal of the capacity grant is to support implementation of the multi-payer fee schedule, to help be a Kickstarter, to help support that implementation. Kickstarter is my word, not DHCS's, but to utilize this funding source in the best way possible. And that will look very different depending on the school district. Next slide. So Mount Diablo has used theirs this way.
So for us, we already have a robust amount of mental health programs. So I wanted to focus on our wellness centers. And what we decided to do, and we'll go into a little bit of details later, is open up first a new wellness center and update our current wellness centers. They didn't have a lot of funding to provide larger spaces, so we're working on expanding our spaces and adding some furniture in there that's a little more friendly for an environment for students coming in who are dysregulated. We also added a new social work specialist and a program administrator to do all of the supervision that is required. One big buy-in to get staff is free supervision. And so we've hired an administrator to provide that, as well as guide our wellness centers to work together instead of the silos that they're currently operating in. Along with that, we're increasing our licenses in our electronic health record system that we operate and have been using for a few years, and then hire a new billing specialist to go along and support all the extra billing we're going to be doing with fee schedule. Next slide, please.
So speaking of the fee schedule, you can go to the next slide. We all are pretty well grounded in what the fee schedule is, the provider types, what we do in the fee schedule. Here's a sample of one of the work streams, the category for case management, but let's skip oh wait, stop, don't skip. Go back for a second. If you haven't heard, and I think everybody has, PPS credential holders are now in the fee schedule officially. The state plan amendment has gone through. Next slide. Okay, so I think this is, you can click through this one maybe. Oh, no, go back. Okay, so on this slide, I want you to think about for an LCSW, this is a tool. Note, it's an exercise, not an exact representation of what the potential billing could be. But in this graphic, you'll see that individual supports for 1 hour is $131, $132 an hour. If a staff billed 50%, just 260 hours of their time or 6 hours a week, the reimbursement is $34,000, a little over. So in each of these categories, if this staff was billing on the fee schedule in these categories, it's 45% of their time productivity rate. And that might actually be a little high out of the gate, but it's a representation of what they might be billing face-to-face services with kids, right? So that equals $74,000 a year. The staff in this example cost $130,000 a year, leaving a $55,000 gap. Next slide. So it ends up looking something like this. Right now, the top blue line, I think that's blue, is where we're at. Funding 100% through grants, through the billions of dollars in resources that have pumped to all of you. And that's posing a problem because we have this gap between where we're at now and what the fee schedule might bill. I want you to think about, I want to dispel a myth. People feel like the fee schedule is this light switch that's going to turn on and everybody's going to be billing all at once and life's going to be great again. It doesn't work that way at all if you've done this work in mental health. It's a gradual incline. We have to build those adaptive skills of staff to bill and document and do these services on the fee schedule. And this is just 3 examples of where those staff might be at. Only time with students or families is going to be billable. So think about the bill and expectations, but we'll have this funding gap. Fee schedule is not going to pay for everything. What do we do about the funding gap? So here's an example of the difference between the fee schedule and EPSDT or specialty mental health services. Could be it's different in every county. $241 an hour as opposed to $131 an hour. A difference of $167,000 a year for 40% versus $91,000 a year. So just think about, as you organize your system of support, I want you to pick up the phone, work with your superintendent, whatever protocols you have in your county, and reach out to behavioral health to partner. Because in order to do specialty mental health services, you'll hear from Jessica, you have to partner with your behavioral health agency. Next slide. Jessica.
Okay, so here's kind of the meat and potatoes of why I'm here today. So if you look at this slide, you can see the different types of funding that MDUSD has and the different areas that they cover. So we're looking at federal and state mental health funds from the Department of Ed. We can see that it does not support students without disabilities. If we look at the Medi-Cal EPSDT, and that's our incoming funds right there, you can see that it covers everybody but private insurance. And then LEA BOP, of course, no private insurance, but fee schedule is covering that gap with the private insurance at a tier 3 level support that we haven't been able to fill. Next slide, please. So when Michael actually asked me this question, and I was like, I really don't know. So we pulled the numbers. Out of our county contract, and why it's so important that we connect with them, is that we're allowed to bill for tier 3 services. And the best part is that we're able to support our students who are on wait lists with county. County has a 4-month wait list. However, we have staffing and pick them up within a couple of weeks. So it's really beneficial for us. You can see here that we are funding 28 positions with our county contract and 13 with our LEA BOP, with a total of 42 staff members just alone on the last bill, or the billing from last school year. And of course, that ebbs and flows every year. Next slide, please. Now with fee schedule, we're going to look at expanding our current providers, and I'm going to show you the number of providers that we have. And again, this is an overall large program that we've been working on for many, many years. So most of our districts are going to be starting really slow. We're going to use this to serve an additional 31% of our students and continue to reduce the number of requests we're getting for residentials, home and hospitals, even reduce the number of our testing for special education, because we're seeing a lot of kiddos who really want our mental health services, and the only avenue is to get into our programs. Next slide, please. So as I stated before, we are very large. We have 72 school counselors with our interns, 40 school psychs who currently bill under our contract, and these are our clinic providers. They also bill under LEA BOP. We then have our social work specialists who I am working with right now and preparing them to bill fee schedule and Medi-Cal services starting hopefully in a couple of months. And then our behavioral health specialists who are BBS licensed, as well as their trainees who are currently billing under Medi-Cal EPSDT and will be billing under fee schedule. We're also entertaining the idea of our school counselors getting into LEA BOP, but that's a very different story when you're talking unions and contracts and all the things. And then, of course, we have our French providers that are all located on our sites, and our contract with County Behavioral Health, who offer us the support with case management, TBS, RAP, ICC, any other needs, family partners. We just give them a call and say we've got a family who needs help, and they help us coordinate services. Next slide, please. And so we're talking wellness centers and fee schedules and starting out small. Your wellness centers are probably going to be a really good avenue to go for. And I say this as you can see here, we served over 5,000 students through our wellness center last school year. But when you're looking at the codes, and that's called a HIPIC code, a 15-minute service will bill you $8. So if you have one person billing 4 sessions a week, that's $32 weekly, but $1,000 annually. If you happen to have, I don't know, 8 to 10 people, you might be able to fund a position. So it really depends. This is how you want to look at it when you're thinking about funding for positions. It's doable. It's very much doable. You just got to crunch the numbers and figure it out. Next slide, please. Now, when we're talking programs and billable services, having licensed BBS folk is great because they can bill at a higher rate. We also look at our behavioral health specialist model, where we really look at small caseloads to do a lot of the case management. Case management is a great billable service, and it provides a great service for our students. So it's the supporting kids in crisis, it's coordinating care, it's attending meetings, helping with a school psychiatry or a psychiatry appointment and medication, right? So our behavioral health specialists are ones that are our associates who are still going to school or gaining their hours. They have 6 students caseload. Our 2s, who are our licensed folks, have 9. And then you go on. Our site-based outpatients. So if you think of one licensed clinician on site can serve 18 students in our district, they can serve a lot of kiddos at a school site. You throw 2 of them there, that's almost 40 kids they can serve. Our trainees that we're pulling right out of grad school who are, who need those hours that we're providing the free clinical services to or supports to, they can do 6 to 10 students. So you're thinking about how many students you can serve, but all their work they're doing are billables. Our trainees bill for more services than we pay them. It's a great savings for the district. And you can see here our contract, for county behavioral health is lower for the psychiatric evaluation, but really high for crisis. And our county contract is higher than fee schedule for most categories. So that's really important to know. Next slide, please. We also want to look at how can we do sustainability and get the costs from MPS back into the district. And so we did decide to house a special day class, right? We all have special day class in our districts. And we decided to put a therapist within them. And so when you have that therapist on site to support, and this is one of our groups that we're celebrating one of our graduating students, we have the ability to serve them and get that milieu service, not only to provide the services they can't get or they would be getting in non-public or even a residential, right? We can be a step down to a residential or precursor to residential, but we're helping to get them back in the least restrictive environment. Many of our programs are on comprehensive campuses, and so they're able to go mainstream lunch, PE, take a gen ed math class, go to football practice afterwards, but they're able to stay on their site and get their mental health support with individual, group, anything that's needed. We actually use our own electronic health record system with Valent. It's very cost effective. We have our billing team, which we'll talk about in a second. We are not charged fee for service. We pay 1 monthly cost per user. They easily adapt to county behavioral health standards and requirements. And so we're able to just, when a form needs to be changed, give them a call, give them the edits. It's great. They're web-based, and then we can pull reports, we can manipulate the data. It's super easy to use, and for fee schedule, it will be uploaded into Availity, so it's a clean kind of transfer for services, and we're able to get our billing done in a acceptable time. Next slide, please. Now, when you're thinking about the structures, if you decide to go with an EHR of your own, or maybe perhaps a few of the county offices that get together and do their own billing system, billing clerks are a fabulous, easy position to create. And we're happy to help and let you know what a job description looks like, what their duties are. Currently, we have 2 account clerks that process the billing for over 50 providers. It's what we call a secretarial position. So it's 11 or 12 months. They do all of our paperwork, monitor things for the clinicians, and we're actually going to a 3rd one with fee schedule. So it's a very doable position at a low cost compared to going with somebody like I know Care Solace is one of the big ones. Okay, next slide, please. I know we're running out of quick time. One of the other things we decided to do is really work hard with our union to create those small caseloads so that we can attract staff, right? We really want our staff, and we promote small caseloads. We do protected time. So there's set time 2 to 4 hours a week where our staff get to sit in office and just do all their paperwork. We also decided to become CAMP approved, which means we can provide continuing education credits to those who need it, which is a requirement of the BBS. So they don't have to take time off. We provide it in-house, no cost to them. And that's a really big deal for a lot of staff because 36 units can be quite costly, and the district is providing that. The other big carrot we do for recruitment is weekly and individual supervision. I know a lot of people have to pay for that, but we provide it. It's also great for training our staff on our systems and providing, availability for whatever questions they may have. We also have tiered positions, so we can promote growth within our own district, because starting with the training when you're, still in school, and going all the way to be an administrator sitting with me, making all the big decisions for the district.
As you think about where we're moving forward, and first, thank you, Jessica, Wendy, Mount Diablo, you're doing an amazing job. I reminded people in the chat, this is a journey. It's a long road. We will get there, and you'll get there and match your ecology that you have in your county and your districts. And that it's different in each of the counties and districts. So thinking about braided funding opportunities in the future, if we had 4 more or 5 more hours, we would go over all of these, but we don't. And so you're going to have an opportunity to think about LEA BOP, Medi-Cal Administrative Services, ECM, Families First Prevention Services Act, and Managed Care Plans, Enhanced Care Management as potential future presentations. I think we have LEA BOP, our friends from West Ed, kind of in the queue to help us understand and advance LEA BOP strategies. But just think about multiple funding strategies. How do we braid these together? Next slide. So remember, tie a knot and hang on. It's a process. It takes some time. There's no single funding source. Our communities all look different, but it requires collaboration with our partners. And this is hard work, as you've seen from Jessica, but it is doable. They have an amazing program. Their data is outstanding. What they're doing for kids is just remarkable. And the fee schedule is going to land there really nicely to pick up that other gap of commercially covered kids.
For those of you who don't know me, my name is Chris Williams. I have the pleasure of serving as Executive Director of Mental Health and Wellness for the Sacramento County Office of Ed. And I am going to welcome you all back from break, first and foremost, and then introduce our discussion and breakout room protocols. And I just want to pause for a moment and offer just a brief editorial note. I heard Michael, he both said it out loud, but also posted it in the chat, that the work that was presented today was the result of many years of collaboration and partnership. And I'm reminded of that Chinese proverb, the journey of 1,000 miles begins with a single step. And Mount Diablo is maybe not 1,000 miles down the road, but they're down the road a bit, and their work is tremendous. And I really appreciate Michael and Jessica, your time, not just in presenting today, but also in all the time that you obviously put into putting that presentation together. And I also want to encourage everyone who's potentially standing at the starting line and looking at the backs of Jessica and Michael and saying, like, how do I ever get there? Well, I think the way that we get there is by taking a single step, right? And that single step can begin today, if it hasn't begun already. But our learning, our breakout rooms are really meant to talk about what did we glean from the presentation, and there are many, many things to glean. I think we probably need an hour just to talk a little bit about how would we process and break down the essential components of what we shared. We don't have an hour. We have about 20 minutes in our breakout rooms. And the breakout questions are here on the slide, but they're also posted in the chat. So what are your key takeaways from the presentation? What do you feel you can apply to your work in your local context at your COE? And then what are the different funding sources you're interested in exploring to meet your vision of behavioral health services in your school? So I think that's a key component for me anyway, your vision, right? How do we set a vision? How do we set a North Star? And then how do we start to collect those pieces of thread to start to braid together to get to the vision, right? Maybe don't start with the thread, start with the vision, and then think about how we want to braid those together to get there. So we're going to give you time in small groups to discuss and reflect on the presentation. Just as a reminder, these breakout rooms are not recorded, right? So this is time just for you all to talk amongst yourselves. Also, the number of breakout rooms means that we will not have facilitators or note takers. Instead, please, when we return from the breakout rooms, we're going to put up a Slido QR code again, and that'll be one opportunity to share out what your key takeaways are. Once the breakout rooms launch, folks will be randomly assigned to a room. And with that, when we come back, we will jump into that Slido, and then we'll have a little bit of a call out around what we shared. Any questions? Okay, and there will be.
Chris, I have a question.
Yeah, Jill.
Hey, will we have access to this slide or this content when we're in the breakout room to remind us of what we're talking about?
David, you can't tell, but I'm looking at you. David and/or Caressa.
Sure. I think we will have these in the chat. I think folks are in the chat right now. So maybe if folks want to go ahead, we will try to put that in for the facilitators in the group. I believe we should be able to access the chat in the breakout rooms.
Okay. And also, you will have an opportunity for Q&A with Mike and Jessica. That'll be after the breakout session. So give you opportunity to process, discuss amongst yourselves. We'll come back, we'll share out, and then we'll do a little Q&A after that. And I think we'll open the rooms now. Welcome back, everybody. I can only hope that you all had as engaging and dynamic a breakout room as I did. Thanks to the folks that I was with. It was a really great conversation, and just really appreciate the level of engagement that we all have. And once again, thanks to Mike and Jessica for catalyzing a really dynamic conversation for all of us. So we are now going to give folks some time to share the key takeaways from the small group discussions through Slido. And as you can see, it's right up here. You can scan this QR code, or you can go to slido.com and enter this room code that's right there and underlined. And I'm going to do my best to not talk for a couple seconds. I know you all know that's challenging for me, but give you all just a moment to enter in your thoughts into Slido. So we'll just pause here for a moment as folks are entering their feedback or key takeaways. And then I think we're going to switch to, there we go. Here are some of the things that are being entered. Discuss the need to get both fiscal program staff on the same page in order to be creative about how to blend or braid funds. Yeah, that relationship building, internal as well as external and school-based, right? It's important to building the infrastructure. We have an untapped workforce in regard to unlicensed mental health professionals. Yes, absolutely. And it's also a workforce development tactic for our HCI friends. Fiscal staff are critical. Yeah, the presentation was very organized, absolutely. Counties and LEAs may need to make shifts in the design of their bureaucracies in order to put, bureaucracies. Unfortunately, that I got cut off there and I can't see the rest of that. An aha moment, MTSS Tier 1 Universal Supports provides many opportunities for blending and braiding from other funding sources. Great, we love the aha moments. Great presentation. Create work groups or discussion groups in the COP interest areas. Yeah. How to get fiscal districts and internal leadership to be on board. Once again, that relationship building, that partnership development. And how do we continue to build those relationships across positions, cross department collaboration right there. Love the participation through Slido. If anybody wants to come off mute, if you're more of a verbal processor like some other folks are, go ahead and come off mute and share some of your key takeaways. I wish the fee schedule really engaged schools in developing Tier 1 services. Well, I think that's an opportunity for discussion. Might it actually engage schools in developing Tier 1 services? I know there's a crosswalk work group on looking at the fee schedule and MTSS, so more to come on that. Okay, well, thank you all for those who shared out with the group. And although we are moving on, we encourage you to continue to add to the Slido. The communication following today's community practice will include a summary of these responses, as well as the slides from the presentation. So we are going to move towards a Q&A, but before we get there, we really want your feedback, as this slide indicates. We want to provide folks a little bit of time to provide feedback on this community practice. As was previously mentioned, feedback from our community COEs is used to inform our communities of practice. On average, we receive feedback from about 1/3 of the folks who participate. So while we really want those 1/3 of you who have been providing feedback to continue providing feedback, we really want to make sure that we're inviting and including all voices. So the link to the survey just appeared in the chat. Folks will have about 5 minutes to complete this brief survey. And while we do this survey, we will play Things Are Getting Better. Just about 5 minutes to complete this survey. Okay, I know folks are not totally done. We'll give you about 10 more seconds to wrap up their final thought. We will leave this open, of course, if you're not quite finished with your evaluation. Okay, well, thank you all once again. So now we're going to move into a Q&A with our presenters, Mike and Jessica, and I think I saw Wendy as well. Thank you all very much for your feedback and for taking time to complete that evaluation. Now we're going to invite Mike and Jessica and Wendy back to the stage, so to speak, and we're going to have a few questions. I believe folks maybe put some questions into the Google form, and maybe David or Caressa, I could ask for your assistance in grabbing some of the questions off of that Google form. And then we can present those questions to our presenters as we have them. Looks like Caressa just, oh yeah, Okay, so here we go. So Mike and Jessica and Wendy, we have a couple of questions here. Let's see. So I see Allison says that Michael mentioned contracts with MCPs for CalAIM services. I spoke with with our MCP, and they've never had a contract with a school. Who has been successful in this?
Yes, so we hope to have another presentation just on enhanced care management with the managed care plans, because each managed care plan has a slightly different implementation. I know Cal Optima in Orange County, they have a institute that they ask people to attend. Santa Clara is different. I know Partnership Managed Care Plan is working real intently with its participants and its COEs in the North State. So I hate the answer, I hate always getting the answer. Well, if you've seen one, you've seen one. But it's worth it to make a phone call, have a coffee with your managed care plan, and just noodle through like, well, what's the relationship? Because SB HIP has changed everything. It really has changed the relationship. So explore.
Great. In Mount Diablo, do the 72 school counselors provide direct mental health services to youth? Jessica, I think that's probably for you.
Great. Wendy, did you want to take these questions?
Yeah, I just went through the ones in the chat. So if I want, I can, and I wrote answers into the, hello, everybody, I'm Wendy. Nice to meet everybody. Been a day. But I did write answers to some of the questions in the chat. So if you want, I can go through those answers, or if not, they're in the chat. But essentially, the first question that we received was, do our counselors offer services to kids? And the answer is yes, but our counselors offer more short-term solutions focus, 4, 6, 8 type of weeks. Once it starts to get past that, they move on over to either counseling with our school psychologist if they're special education. We also have a counseling clinic that operates through our county behavioral health department, where we have a team of itinerant, they're school psychologists, but they bill under rehabilitation services. And then those services are provided to general education and special education students. So once it gets past that counselor part, they kick in. So hopefully that was helpful.
Super helpful. There is also
Yeah.
a question around how do you fund your clinical supervisors?
Yeah, so we use our mental health dollars that are allocated to each LEA for mental health services. And then we also use some of our just regular AB 602 special education funds for that. We also actually use some of our, they're split funded with general education funds, so that we can use them on the general ed side to work with the counseling clinic for those gen ed students. I think really so actually braiding the funding, that's probably one of the easier parts because it's math, right? This is how much the position costs the district. This is how much money we have. This is the allowable uses in each stream. That's the easy part. The harder part for us has been really braiding the systems, right? So for example, we have, I just mentioned our contract with County Behavioral Health. And so we bill through our electronic health record system through that county behavioral health record. And that works out really well because that also will feed into the new program that we have with Carolyn, right? That's all going to pull from our electronic health record system. However, our school psychologists aren't billing through that system. They're billing through our LEA BOP system. So when you're looking at graded funding, don't just look at graded funding, look at where that funding is coming from and look at where the, what are the strings and reporting requirements attached for that funding, and make sure that the systems go together, not only that you have the contracts for external, but inside. I can tell you our school psychologists, making them bill through both systems, it's a whole different thing. That's a smaller union. They're all mental health focused. It's a whole lot easier doing that than to deal with our counselors that are in our teacher union that may not be exclusively focused on, mental health, right? They have a different focus, and the work impact is a significant factor. That would be the other thing that I would advise you of as you're looking at braiding fundings, not just systems, is really work well and be transparent with your bargaining units. Our psychologists union, we've had really good success with them just by showing them this is how much a position costs. In order for us to maintain these 10 positions, we need to generate X amount of money. In order to generate X amount of money, you got to bill for X amount of hours per day. And while I realize you would rather be seeing kids, we would also like for you to be employed, as would you, and really be transparent with the math on that. It sounds like all of these things are really silly to be saying. They're just things we know. There's no magic pills we can take, or no, if I had the magic wands, I'd wave it all right now and all this would be done. I don't. It's just simple math and simple good communication skills.
So I really appreciate that, Wendy, and I want to just see if we can lean into that a little bit, because while the math might seem simple, the motivation is sometimes a little bit more challenging, right? Like if folks are used to assigning one FTE to this funding stream, and that's the way we've always done it, how do we break folks of that mindset when we say, like, but this FTE doesn't have to be funded out of just one funding stream? So can you talk a little bit about those kind of adaptive challenges that maybe you leaned into in your time there?
Yeah, 100%. Actually, it's really interesting. I just pulled everybody together, the entire group. I pulled the psychologists and we call them behavioral health specialists. There are MFTs and LCSWs, and those work across our site-based systems, our classroom-based systems, and our itinerant-based systems. And I pulled them all together, and I had a chart. And it was special ed, not special ed, Medi-Cal, not Medi-Cal. Who can see which group of kids? And I had all these yellow boxes. And then so, like, this is ridiculous. Why is it that the BHSs who are higher qualified can't actually see these people? Why can't we do this? And I just really asked them the questions. Why is it this way? We sort of built this system, and then we ended up with something that was quite Frankensteinish. So then we all sat down and said, okay, how do we redesign it from the ground up? But I went and did the presentation to the all of the people, the psychologists and the BHSs and the union leadership. Before we started negotiations, for two reasons. One, I really like those people who lead our psych union. I think they're great. I think they're nice people. And I'll be really transparent. During the pandemic, they were the one group in our district who was all about how do we serve kids right now. Right, they were so good, and I wanted to honor that and not throw them under the bus. So I wanted to be like making sure that whatever we did was transparent. It was coming from me, not them. It was based around changing systems, changing financial streams, and common sense. And once we spelled it out in those charts, like with the yellow blocks, it just made sense. There was no arguing with it.
So helpful. And just that identifying that, like, we're all here to serve kids, and you've demonstrated that through your behaviors. So, like, now here's another way to serve kids. Is like, was that part of the conversation?
It wasn't here's another way to serve kids. It was really more about that we were reducing artificial barriers that didn't exist. It just didn't make any sense at all. The barriers that we were having, I'm actually looking through my slides right now. So you can see, I was going to show you the slide deck that I had, because it was just so logical. You're already doing these kids. Why are we not, switching our billing? And not, like, for an example, we have our licensed clinicians, right? So why was it that our licensed clinicians were not able to serve in our clinic, yet our psychologists were? It just didn't make any sense. And so once we started showing them that, they were all on board with it. I will be really transparent and tell you that the itinerant staff who had not been doing full Medi-Cal notes maybe not had been as excited about it as, now all of a sudden they had to do that and it didn't make any sense. Do you mind if I share the screen and I can show you the chart that I had given them?
Well, yeah, let's do that. But then also, Wendy, we're just about up against our time limit.
Yeah.
So I wonder if it's possible for you to share that slide deck with us, and then we can share it out with others.
I'm putting it in the chat right now. And so you'll kind of see what we did, just set it all out in terms of this is how funding works. This is what you're assigned to do. It was very methodical, and I'll make it so it's public that you can see it. I gave it anyone with the link. There you go. And it was just pretty straightforward. Here's who we're seeing and here's who we're not seeing. Here's what you're doing and not doing. Here's who's licensed and not. I'm not asking you to change anything. I'm asking you to be a little bit more flexible with your boundaries. And then we wrote an MOU on that.
So here are the words that I'm hearing, right? Common sense, transparent, it makes sense, practical, right? Like just your approach, what I'm hearing in your approach is, here's the problem we want to solve. Here's how we can solve it. Can we work together to solve it? And it seems
Exactly.
I just really appreciate your perspective. Thank you for after the day that you've had joining us for the remaining couple of minutes. And I don't know, I'll speak for myself, but I wish we had another hour to talk about this, but really appreciate your time. And thanks to everyone. This is our kickoff to the Blending and Braiding mini series. So hopefully this was a great kickoff. To me, I think it was fantastic. Mike, Jessica, Wendy, thank you so much for your time. And thanks everyone for joining us. And we will see you Friday at office hours. And we'll see you next month for our next series.